Hi everyone, my name is Nurul Ain Natasha binti Muhammad Hanafiah. Today I will be sharing the article Burnout and the Role of Authentic Leadership in Academic Medicine by McPherson and her team, a timely topic within our course Change and Organizational Development. The study talks about how a good leadership style can help reduce burnout among healthcare workers, especially in academic hospitals. Burnout is a mental health issue that happens from too much stress at work. In hospitals, especially where doctors also teach and do research, burnout is very common. Workers feel tired, overwhelmed, and sometimes unappreciated. The article says leadership plays a big role in preventing burnout, not just individual effort. Good leadership is very important to stop burnout. When leaders care about their team and support them, workers feel less stressed. A great example is authentic leadership. This means the leader is honest, open, and easy to trust. When employees trust their leader, they feel safe to talk and ask for help. This makes the workplace healthier and help everyone feel better. The study wanted to see how a leadership style called authentic leadership affects burnout. They did focus group with 71 people from 4 different hospitals. The participants include clinical faculty, trainees like residents, researchers, and administrative staff. They used 4 main traits of authentic leadership to guide the study. The first trait is balanced processing. This means leaders listen to all opinions before making decisions. People felt frustrated when leaders ignored their ideas. Trainees and faculty said they felt more motivated when leaders actually used their feedback. But when leaders just made top-down decisions, people felt powerless. For example, if UMMC leadership includes nurses and junior doctors in planning new shift schedule, it helps them feel respected and reduce feeling of helplessness. Next is relational transparency. This means being open and honest. People like when leaders shared their feelings and were real. One example was a leader who cried with a trainee after a patient passed away. That moment showed it was okay to feel sad. But sadly, most said they rarely saw this kind of honesty in their leaders. The third trait is internalized moral perspective. This is when leaders act based on their values, not just rule. For example, if a leader says wellness is important, they should take care of themselves too. One trainee said seeing their leader take time off made it feel okay for others to do the same. The last trait is self-awareness. Good leaders understand themselves and reflect on how their actions affect others. Some leaders showed their passion for helping patients and it motivated the team. Trainees also wanted to lead by example and support their peers. A leader at HUKM who openly supports shorter meetings or respects personal boundaries shows they understand the value of mental well-being. A real-world example that related to the article is the University Malaya Medical Center (UMMC) in Malaysia. Like the University of Colorado in the article, UMMC is an academic medical institution that combines clinical service, teaching, and research. This institution faced similar challenges: staff shortage, high workload, and role conflict among clinical staff, researchers, and medical trainees. All of this increase the risk of burnout, especially when leadership fails to address emotional stress or involve staff in decision making. Based on the article, here are real, actionable solutions that healthcare institutions like UMMC or HUKN can adopt. Firstly, include staff in shared decision-making such as involving doctor and nurse in policy or workflow changes. Second, train leaders in communication and emotional openness, especially when facing crisis or change. Next, embed authentic leadership training into medical education and staff development programs and recruit leaders not just based on experience but also on value like empathy, integrity, and transparency. By implementing this leadership practice, hospital can reduce burnout and build a healthier, more resilient workforce even in time of change. To conclude, this study shows the authentic leadership can help reduce employee burnout. When leaders are honest, caring, and open, it creates a better and more supportive workplace. There are 4 main steps we can take. First, let employees be part of making decisions. This makes them feel involved and valued. Second, train leaders to show emotions in a healthy and open way. Third, add leadership training to education and job programs so future leaders are ready. Fourth, choose leaders who are naturally honest, caring, and trustworthy. In the future, it's important to teach this skill and check how well they work to improve employee well-being. Thank you for listening to my presentation. I hope you learned something new about how leadership affects well-being in healthcare. I'm happy to answer any question. Thank you.